Good morning, everyone, and welcome to Where Justice Meets Action. I am Dr. Tara Y. Wren, Director of Communications for the Mississippi Center for Justice, and we are very grateful that you have joined us today for this very important conversation. Where Justice Meets Action is a quarterly virtual meeting where MCJ provides this platform for our most important donors and our supporters and other stakeholders to engage with us in meaningful discussion about important issues and learn how MCJ is actually advancing racial and economic justice across the state of Mississippi. Now, as many of you know, earlier this summer, Congress passed and the president signed into law the federal budget bill that we're calling the Big Beautiful Bill. Unfortunately, the impacts of this bill are anything but beautiful. Its massive cuts to Medicaid presents a serious new threat to health equity in Mississippi. With our state already having one of the highest uninsured rate in the nation, consequences could be devastating for our children, our elderly, vulnerable adults, and pregnant women. Today, we're fortunate, though, to have MCJ's experts in health equity, and Haria Turekin, our Director of Advocacy and Policy, and Linda M. Dixon, our Director of Health Justice Campaign, will walk us through the key provisions of this bill and share what it could mean to families and communities across our state. The last voice you'll hear today will be that of our President and CEO, Attorney Kimberly Jones Merchant. We'll also leave time for questions and comments for you to talk back to you. So if you have any questions throughout this conversation that you're hearing, please feel free to put them in the chat and we will respond and talk about that toward the end of the conversation. We thank you for being with us today because your engagement with us make our work possible. So with that, I'll turn it over to Haria.
Thank you, Tara, and good morning, everyone. As Tara said, my name is Haria Tarikin, and I'm the Director of Policy and Advocacy here at the Mississippi Center for Justice. I'm joined today by my friend and colleague, Linda Dixon, and as the Mississippi Center for Justice, we are committed to increasing care and coverage for all Mississippians. As such, when the Big Beautiful Bill was being negotiated, and once it's been passed, we have been keeping a close eye on it and making sure that we are ready to respond and protect those who are most vulnerable. And so with that, Linda, let me ask you, a lot of people have been talking about the Beautiful Act, what it means, what it does, but how does this really impact Mississippi and Mississippians?
Well, first of all, good morning, and thank you so much for that introduction. Look, the impact on Mississippi is going to be detrimental to the health and well-being of Mississippi's children and families. When we look at people who are currently covered under Medicaid and the threats that would happen to them, Medicaid covers 49% of all Mississippi's children. We're talking about half of the children in our beautiful state are covered by Medicaid and CHIP. Our children deserve to be in environments well and not sick so that they can, be in environments that are conducive for learning. So we really have to make sure we protect our children. It also covers children with special health needs and concerns and children in foster care. Another impact that we want to make sure we're looking at is how the care of the 74% of nursing home residents in Mississippi. It provides critical nursing home and community-based services for seniors and for people with disabilities. So these deep cuts will severely threaten the Medicaid coverage for thousands and thousands of Mississippians. And when we look at what the government contributes to the state of Mississippi, $3.33 for every dollar the state invests. We're looking at $5.1 billion annually. This money covers 57% of births. That's a lot of births and care in Mississippi. Again, 49% of children and 74% of nursing home care. Now coverage for Mississippians on Medicaid is reaching almost 700,000 people. We are looking at a significant part of our population. We have 2.9 million people in the state of Mississippi. So we have a lot of people, we have a lot of families and a lot of children counting on not, being able to have their health care. The most conservative estimates have over 33,000 Mississippians becoming ineligible to enroll for Medicaid annually, and this is over a 10-year period.
Great. And well, not great, but when we are talking about that federal match, Mississippi has one of the highest federal matches in the country. And a lot of states are going to have to now get state budget, figure out how to use their state budget to cover that loss from the federal government. What are we looking at in Mississippi? I don't know if the callers on the call know, but Mississippi recently, in the last legislative session, cut state income tax. And state income tax in Mississippi will be going down to 3% by 2030 on a schedule to get to no income tax. And so the deficit in our state budget without the Big Beautiful Act is already a huge one. What does it mean for Mississippians when we have a deficit in our state budget coming from the federal cuts, and now we will have a deficit in our state budget from the state income tax cuts?
Well, and as you said, Harry, Mississippi recently cut income tax. And now with fewer federal dollars and reduced state revenue, we will be forced to make some impossible choices between funding healthcare, and we know what else is going to come up, education, and what else is going to come up, public safety, and anything else that is deemed touchable to be able to satisfy the cuts that the state is going to experience. So the threat is for everything that's on the chopping block for our state budget.
And one of the biggest places that Mississippi is going to be hit is hospitals, right? And hospital expenditures. Can you talk a little bit about what our hospital and healthcare infrastructure is facing?
Absolutely. And it's going to be huge. Mississippi could lose a whole lot of money, between 2.4 billion and as high as 4.8 billion, due to these cuts with hospital expenditures. This is for sure going to be a major setback for the state's healthcare infrastructure, especially for rural hospitals. About half of Mississippians live in rural parts of the country, of the state. So we're already at risk of closing, hospital closures now. Many people will have to travel 1 to 2 counties over to get the health care they need. And I used to say, well, this is, kind of dramatic to say this is a life and death situation. This is a life and death situation. If you are in a chronic emergency and you have to travel, whether it's by car or ambulance, to the nearest hospital, to the nearest emergency room, and it's 2 or 3 counties away. That is going to be not good just for people who are on Medicaid or CHIP, but for anyone. Whether you have private health insurance on the marketplace, it's going to affect everyone. That's why this is everyone's problem. We should all be concerned about what happens when we're in the condition, or a family member, a loved one, and they need access to health care but can't get it. And even looking at the reduction in services in hospitals, obstetrics, gynecology for babies and delivering is going to diminish, and even chronic care and other things, specialty doctors. So that's going to definitely be affected.
And let's talk a little bit about how it's going to impact people who have health insurance, right? And even people living in urban areas. When you say that rural hospitals are going to close, that means those individuals who usually go to those rural hospitals will be coming into Jackson. Jackson UMMC is the only level 1 trauma center in the state already, and is already overloaded by seeing every level 1 trauma across the state. But if bigger hospitals, rural hospitals, close, that means people will be coming to Jackson to get their healthcare. So can you talk a little bit about how it affects even individuals with healthcare, not with healthcare or health insurance that's not Medicaid? What does that impact look like on those individuals?
That is it's also going to affect people with health insurance. Jackson and other hubs in the state have a concentrated area of physicians, providers, nurses, and otherwise. So when you even look at the totality of the state and where hospital closures may happen, it is everywhere. So even if you have a hospital in your area that is in your immediate area, you still have to, get transportation there. And we all know that the transportation system in Mississippi is poor, and in some places is non-existent. So even for people who can't afford, is going to be an issue. And we're looking at, Mississippi is one of the top 5 states in the country with the highest number of rural children, for example, covered by Medicaid and CHIP. And some estimates suggest that we could lose up to $550 million in federal funds per year. Right now, for at least 8 rural hospitals, that could be a fatal blow. And it's not just 8 at risk of closing, it's more than that. But in the immediacy, it's going to be, bad.
And so, Linda, you have been working on Medicaid expansion since the passing of the Affordable Care Act. We got very close last year, and we have had some wins, like with postpartum care and predetermination. But where do we go from here as one of the 10 states that has yet to expand Medicaid? What does Medicaid expansion look like now?
That's a great question, Haria. Under this bill, under this act, the financial incentives are going to diminish, they're going to vanish. This bill makes it harder to expand, and the expansion is going to cover less people, just like the current traditional program. It's going to be no different. This act includes a few things that we should all be concerned about. One is the work requirements. We have all heard about the punitive nature in which people on Medicaid and other ways have been asked to work a certain amount of hours. A lot of these people are already hardworking Mississippians who, serve us in restaurants and hotels, cut our hair, construction workers. So these people are already working. But beginning December 31st of 2026, adults enrolled in the Medicaid expansion group must meet community engagements requirements, such as working, volunteering, or being enrolled in school at least half time for 80 hours a month, or they face disenrollment. I can think of so many things wrong with that. Also, the elimination of the American Rescue Plan Act. We all know the influx of federal dollars that came into the state of Mississippi and many other states to help support Mississippians. But this act is going to remove 5% increase in the federal matching funds for states that adopted the Medicaid expansion under the American Rescue Act. And this is going to be effective December 26. More frequent eligibility requirements. Again, administrative barriers that will prevent people or discourage people for applying for Medicaid or CHIP. So starting in December of 2026, states are required to conduct eligibility redeterminations for expansion enrollees every 6 months instead of the previous 12-month period. That is absolutely ridiculous to do that. And finally, one point I want to bring up is the cost sharing. Beginning October of 2028, some Medicaid expansion enrollees with incomes just above the federal poverty level will face cost sharing capped at $35 per service, or 5% of their income, which is also an issue. Now, the things that I just talked about, especially the recertification, that administrative barrier is going to be huge for even our divisions of Medicaid to have to do that not only once a year now, but twice a year. So that in itself, the administrative burden is going to be enormous, as we saw during the unwinding of the public health emergency when people were not certified or recertified rather for 3 years.
Thank you, Linda. Now that we have thoroughly depressed everybody on this call, let us shift gears a little bit and talk about what is MCJ doing in response to the new law? How are we responding?
MCJ, we have looked at a few ways that we're going to approach this, but today I want to elevate one in particular, and that's our hospitals, our rural hospitals. We know that there's going to be a huge negative impact on hospital funding, on services to communities. So we're conducting an assessment of hospitals across the state. And we're going to have an emphasis on rural hospitals, which seems to be the most threatened. MCJ is just going to delve into this, into all the hospitals in the state. The impact on hospitals we know will strain the healthcare infrastructure in Mississippi, especially in the rural hospitals who are already at risk of closing. So we're also doing a landscape analysis on the risk of closure, again, focusing on rural hospitals, but not just closures. We also are looking at a reduction in services, the hospitals that will not close, but that will significantly or mildly reduce the types of services or even staffing in their respective hospitals. We also going to be looking at the time factor that it would take a person to get care from their city or county to the next city or county and what that really looks like. If people know that you have an hour and a half ride to get to a hospital for care, that's a problem, and we need to know. And we also have to think about emergency medical service with transport. How's that going to look? How's that going to look for someone who doesn't have an automobile, or if they're in a chronic situation and can't be transported by an automobile? So we're going to be looking at all of that, and of course, tracking the impact that this is going to have on communities and families. And of course, we'll continue to, elevate Medicaid expansion and all that it entails.
Right. And what can people who are on this call do to engage in this fight against the act and to make sure that Mississippians are able to live healthy lives?
Absolutely. We want to know what people's experiences are. Please let us know how you and your family and your communities are dealing with this. Even now, what are your experiences accessing healthcare, whether it's a hospital, a community health center, or a service like a specialty doctor? And we're going to continue to compare as we move into implementation of this bill to see where we need to put more focus and emphasis. The Mississippi Center for Justice wants to do and is driven by what the community is experiencing and by what you're telling us. So we really want your input and we want to know your experiences.
Great. And before I turn over to questions, I also just want to highlight that the Big Beautiful Act also has a huge impact on SNAP benefits, and that we're looking at food off the table for potentially 200,000 children and families, and that our economic justice team will be focusing on particularly this legislative session and figuring out what pieces of legislation we can push forward to force the state to stand in the gap of the federal dollars that we'll be losing and the proper administration of SNAP in Mississippi. I see that we already have one question from Ms. Graham in the comments that says, can we get this report on the landscaping project?
So we will publish findings along the way. We're not going to wait until the bitter end. We want to get it out as we get it. so that people know what's going on in their communities and in our state. Because it's
And
going to be a process. It's going to be a
yes.
process, but we want to let it out before the end. Yes. Thank you,
And we
Madam.
also dropped into the chat the health@mscenterforjustice.org email address. If anybody has stories to share, questions for the health team, that is the best email address to reach Linda and her team at. So please write that down. And if anybody else has questions, we can take more questions now.
All right, I received a question for you all. The first one, I actually have two. When are we going to start feeling the effects of this bill?
You know what? We're feeling it now because we're trying to figure out what's going to happen. People are already in panic mode. People have to be proactive in terms of their health care and how they're going to take care of themselves and their families. I've already shared the timeline, and we're happy to put that statistics and data in an email to everyone. I'm not sure how we're going to follow up with that, but as mentioned in the timeline, this is going to go through 2026 summer start up to 2028 and beyond. And we're still delving through the bill as well. So these are just the highlights that we can share with you at this time.
Great. And we have another question in the comments. When I talk with certain members of society, they say, well, if most Mississippians on Medicaid already work, what does the new requirement really do? What is a good response to that?
The new requirement is for states who have expanded Medicaid. We have not expanded Medicaid yet, but it doesn't mean that our state cannot implement or go through the process with CMS to do a work requirement. They've done it before, and it's been many years, but every now and then it'll come up. And of course, in the conversations and debates about Medicaid expansion, it came up that was one of the things um, they wanted to see in the legislation this past session. So it's going to keep coming up because I think they think, well, you got to do something for it, but that's not really what this is about. It is about access to health care for hardworking Mississippians who make too much or don't qualify for the traditional Medicaid program and don't make enough for the health exchanges. And that's going to be a problem because the health exchanges also has its own issues that it's going to have to deal with in terms of this bill.
I think another point to mention with any work requirement is that the rigidity of the work requirements means that individuals that work part-time, work more on certain weeks, lose shifts on other weeks, might not be eligible even if they are working the amount that is dictated because of the strict requirements. And so a lot of the people in the coverage gap right now in Mississippi and in that group of people that get Medicaid when Medicaid is expanded often work hourly jobs, jobs where they're picking up shifts. And so it's not easy for them to prove or stick with such strict work requirements, which is why we and other states have fought against work requirements for a long time. So even though Mississippians are working, having any sort of rigid work requirement means that a lot of people will still fall out of qualification, particularly when you're doing a redetermination every 6 months, which is also part of the expansion. Another question we have in the chat is, do you have data on how people who have insurance will be impacted in terms of increased cost?
Sure. I can speak to the health insurance marketplace a little bit. That, of course, is where Mississippians can go and look for health insurance on the marketplace. We know that, let me just say this to give you just a little numbers. We had almost 275,000 Mississippians that were enrolled in a healthcare plan through the marketplace. And 99% of Mississippi enrollees received an annual premium tax credit to help them pay their premium. Well, this bill is going to make it harder for Mississippians to access the marketplace coverage by ending the automatic re-enrollment. They want to end that, imposing new requirements for documentation. Now, these are people who are paying for their health insurance, and restricting eligibility. That is surely going to affect people who are currently covered. And when you look at that combined with the expiration of the enhanced tax credits that's going to happen in 2025, these changes are expected to result in over 11 million people becoming uninsured by 2034. So this is going to be a long process. It's going to be a long uh, process just for people expecting what to expect. What's going to happen to us. So it's not going to be all at the same time. It's going to be gradual, but we need to be on it from the beginning.
And Linda, I just want to highlight what you said about the tax credits.
Mhm.
So enhanced premium tax credits have lowered premiums for Americans with health insurance since 2021 with the passing of ARPA, and they've been renewed every year. They're set to expire at the end of 2025, and the Act does not extend them. And so with the reduction of that premium tax credit, for a family of four making $65,000 a year, we believe, or we've seen estimates that say getting coverage on the marketplace will go up 158%. So it's really a huge increase because this premium tax credit that we have had every year since 2021 is going to go away. And that effect will be seen at the end of this year.
And if I might add, all of this, we say it's going to be detrimental for all the reasons we've discussed. Mississippi already faces some of the steepest health challenges in the country. We rank bottom of every health indicator and at the top of every health disparity. So these cuts will push our already fragile system, our healthcare infrastructure, into a brink. So, and we talked about the administrative barriers that's designed to discourage people from seeking health care. Mississippi can't afford these cuts. Mississippi can't afford to be sick.
And we have another question in the chat, which is, are there statistics on how the lack of broadband and the lack of other technology will harm citizens in light of these recertification and re-enrollment requirements? And I can start on that one. I'm not sure that we have stats, but Linda, can you speak a little bit about how difficult that was at during the unwinding of the public health emergency, where we did see the need for a lot of recertification and re-enrollment? Because I think that will highlight how difficult it will be to do this every 6 months, even for these rural communities without broadband and technology. I know that you worked a lot with the Division of Medicaid to figure out how to reach people that needed to, provide their address, update their contact information, and go through recertification at the end of the public health emergency. Can you just talk about some of the barriers that you all faced doing that work?
Absolutely. It was a lot of people. And, people had to figure out how to even update their contact information. And not only do a lot of areas don't have a strong or broadband capabilities at all, but we're assuming that everyone has a smart device or smartphone or computer to even get online to do this, which is difficult. And then you expect people who may not be as technically savvy to make this happen. So broadband in itself, the technology that we use to even communicate, it was definitely concerning and an issue. It was important that the Mississippi Center for Justice was in community, helping people, giving ideas about how to do this and supporting in that way. Another factor I want to consider is telehealth. So broadband, of course, would support what that would look like for people who are in areas that can get service, for healthcare and different healthcare reasons. Of course, it doesn't cover all, but for things that it would to be able to have telehealth, if you don't have a strong connection, it doesn't work for you. So I think there are a few considerations there.
I think another large issue that we faced is for individuals that are getting snail mail. You know, a lot of people get a ton of mail from the Division of Medicaid or anywhere else, and so it's very easy to ignore. Um, it is very likely that people will miss snail mail coming through every 6 months to do their recertification. And that challenge of losing your healthcare and then reapplying is going to be huge, not only for individuals, but for each Office of Medicaid in these areas that has to go through this process with each individual. So having to rely on snail mail or having to rely on individuals having connection to broadband is going to be a huge problem in a state like Mississippi. I believe, Tara, you had one more question, and I think that's the last question that we have time for, but
Yes, and I think Ms. Linda may have answered it. It is, how is the law going to affect the health insurance marketplace?
great. So we did answer that.
Yeah.
Thank you all so much for joining us and staying so engaged. Like Linda said, we will be publishing information on our landscape analysis. We hear a lot about hospitals being at risk of closure, but part of why we're doing this study is we don't know which hospitals. We want to understand the funding mechanisms. We want to ensure that citizens know how to advocate, advocate for their municipalities to fund these hospitals, advocate for the state to fund these hospitals. So we will keep you all posted. And with that, I will turn it over to our president and CEO, Ms. Kimberly Merchant.
Hello, I see there's a final question in the chat that I'll address. Will you host other meetings at a variety of times? Yes, Where Justice Meets Action is now a quarterly meeting on various topics affecting Mississippians. So if you signed up for this session, you will be added to our mailing list, and as such, you'll be getting notifications about our next series, which will be in the fall of this year. I want to thank everyone for joining us today for Where Justice Meets Action. I want to take a moment to thank my colleagues and our experts, Harriet Tarakin and Linda Dixon, and for helping us understand not only what's at stake with the cuts to Medicaid, but also what it means for Mississippi families and communities. Your support makes it possible for MCJ to meet these challenges head on. It's important that we are both flexible and nimble, time where every day new challenges come our way. If you're moved at all today by what you've heard, I want to invite you to donate and to help us continue the fight for health equity, and justice across Mississippi. Every contribution, I don't care how large or small it is, we have people who do small dollar reoccurring, $20, $25, $15 a month. It all makes a huge difference. It fuels our ability for our advocates. It gives us the ability to protect and to create what we want to see as a more justice future for Mississippi. You can do so by scanning the QR code or the link that's provided in the chat. I also want to share a few important announcements. Tickets are now on sale for our MCJ's, what we call the Social Justice Empowerment Experience, and we would love to see you there at some point. It'll be a powerful gathering that includes on October 23rd, which is a Thursday, our flagship fundraising event, the Champions of Justice Dinner. And we have some really exciting announcements coming out very soon about who will be there. And I hope that inspires you to want to come as well. That'll be in Jackson at the Westin Hotel. The following day on Friday, we have what's called the Justice Brunch on October 24th. It'll be held at the Mississippi Museum of Arts. And our wonderful guest speaker, who we'll be announcing very soon, will also be there on a panel to, engage us in a very meaningful discussion around the state of Mississippi as it relates to these efforts to ban free speech across this nation through bans on books and things of that nature. But we'll talk about it later. You'll see the announcement as these events unfold. And then finally, after that Friday, it starts and culminates into what we call the Great Mississippi Road Trip. And it is a bus tour from Jackson, Mississippi, all the way to the Mississippi Delta, where you'll learn more about the culture, the civil rights history, and even the work of MCJ. It's a fun trip. And every year we have a wonderful time sharing our work, but also sharing the beautiful culture and sharing the beautiful music, the heritage of Mississippians across Mississippi. I also want to encourage you to stay connected with us by visiting our events calendar at mscenterforjustice.org. There you can find our upcoming workshops, our legal clinics, and our community events where we actually put justice into action on the ground every day. This concludes our programming. I want to thank you again for your time, your partnership, and your commitment. Together, we're making a better Mississippi.